Picture going to the doctor, hoping for healing, only to discover that behind the white coat lurks negligence, profit-seeking, or secret experiments. Across history, some medical professionals have crossed ethical lines, betraying their patients and shaking faith in healthcare. Today, we count down the top 10 medical scandals that shook patient trust. 1. The Tuskegee Syphilis Study, USA 1932-1972. For 4 decades, African-American men with syphilis were denied treatment so researchers could observe the disease's progression. Even after penicillin was found to be effective, the study continued. Many died or suffered severe complications. Public outrage eventually forced a shutdown, forever scarring trust in government-led medical research. 2. The Thalidomide Tragedy, 1950s-1960s. Marketed as a safe sedative for pregnant women, thalidomide caused thousands of birth defects, babies born without limbs or with severe malformations. Pharmaceutical companies initially downplayed the risks. Public outcry led to stricter drug testing regulations worldwide, but not before it devastated countless families. 3. The forced sterilizations under eugenics programs, early mid-20th century. Countries like the USA, Sweden, and others carried out forced sterilizations on individuals deemed unfit, including those with disabilities. Doctors backed these policies, believing they were improving society. The victims lost reproductive rights and endured lasting trauma. These programs were a stark violation of bodily autonomy and trust in medical ethics. 4. Dr. Kermit Gosnell's clinic, USA, arrest in 2010. Operating a filthy clinic in Philadelphia, Dr. Gosnell performed late-term abortions under horrendous conditions. Investigators found unsanitary tools, fetal remains, and unqualified staff administering anesthesia. Charged with murder and other crimes, Gosnell's case revealed a shocking failure of oversight, eroding faith in clinic regulations. 5. Japan's Unit 731 Experiments, World War II. In secret labs, Japanese military doctors conducted lethal experiments on prisoners, testing chemical weapons, infecting them with diseases, and dissecting people alive. Officially concealed for decades, these atrocities exemplified the darkest side of militarized medicine. Survivors and historians continue to demand accountability. 6. The Stanford Prison Experiment, 1971. While not purely medical, this psychology study at Stanford University saw guards and prisoners in a mock jail. The guards became abusive, triggering mental breakdowns. Though intended as research into authority, its unethical nature, lack of informed consent, and psychological harm eroded trust in research protocols designed to protect participants. 7. The Elephant Juice Trials, Kenya, 1990s. Big pharmaceutical companies tested new HIV drugs on Kenyan patients who lacked full information about side effects and outcomes. Critics accused them of exploiting vulnerable communities. When adverse effects rose, many participants felt betrayed. It echoed wider issues with drug trials in developing nations, where oversight is often lax. 8. The Henrietta Lacks Controversy, USA 1951. Doctors took Henrietta Lacks's cells without her knowledge while treating her cervical cancer. Her HeLa cells became the cornerstone of vital research, helping develop vaccines and treatments. Yet her family had no idea, and neither Lacks nor her relatives received acknowledgement or compensation for decades. It sparked debates on patient rights and informed consent. 9. The Guatemala Syphilis Experiments, 1946-1948. Funded partly by U.S. public health agencies, researchers intentionally infected Guatemalan prisoners, sex workers, and soldiers with syphilis to study treatments. Many victims were unaware or coerced. The public only learned of these horrific trials decades later, prompting formal apologies but leaving deep scars on international medical ethics. 10. The Miracle Mineral Solution Scandal, 21st century. Marketed as a cure-all for ailments like autism and cancer, Miracle Mineral Solution, MMS, turned out to be essentially a form of bleach. Promoters urged desperate patients to ingest or administer it to children. Medical boards condemned it as fraudulent and dangerous. This modern scandal shows that harmful cures can still arise when trust in regulation slips. Outro. From unauthorized experiments to harmful drugs, these scandals remind us how medical power can be abused when ethics and oversight fail. The aftermath of each forced changes in laws sparked public debates and tested our collective faith in healthcare. Which scandal do you find the most shocking? Let us know in the comments. If you value these cautionary tales, make sure to like, subscribe, and tap that notification bell. Until next time, stay curious and stay informed.